I'm Sherry Boschert at the annual meeting of the American College of Obstetricians and Gynecologists. Dr. Kerry Rut reported that something as simple as a reminder stamp in a patient's chart can significantly increase the percentage of women vaccinated against HPV.
There was a study actually done at Winthrop, which is where I had done my residency, and the person that had done that study looked at factors that influenced whether or not people had received the Gardasil vaccine. And it didn't have anything to do with insurance or age or the reasons that they came in for the visit. The only factor that influenced whether or not they got vaccinated was whether or not the provider had counseled the patient about the vaccine. So I had figured that if we could remind the providers to counsel the patients about how wonderful of a vaccine Gardasil is, then more patients would be willing to accept the vaccine. When we first determined our baseline vaccination rate in our outpatient office, we were originally looking for a 50% increase over and above what we had. We originally anticipated that our baseline was going to be about the national average baseline, which was about 25% in the year that the study was done. So we first evaluated our baseline vaccination rate, which was actually less than the national average for that year. We had made up a stamp, and it was just a basic, simple reminder stamp, and the providers were to check whether the patient had already received the vaccine, or whether they were counseled and refused, or whether they were counseled and were accepting the vaccine. So this was in place over 6 months. The reminder stamp was in place over 6 months. And we actually saw a statistically significant increase in the amount of patients that accepted the vaccine with this Gardasil reminder stamp that was in place. So our original baseline was about 11%. With the reminder stamp, we were at 49%. The nurses were instructed that any patient between the ages of 18 and 26 that were coming in for a visit other than an obstetrical visit, so any postpartum visit, gynecologic visit, a well woman exam, any problem visits, they were to have the progress note on the date that they came in stamped with this Gardasil reminder stamp. Now, all of the providers did have an increase in the percentage of patients that were vaccinated. We showed statistical significance in 3 out of the 6, and overall there was a very statistically significant increase. Especially with electronic medical records that are up and coming, there is potentially a way to put this into the chart so that a flag would come up or a reminder would come up that this patient has not received Gardasil and that she should be counseled and potentially vaccinated.
Reporting for IMNG Medical Media, I'm Sherry Boschert.